The heart is an amazing organ. This powerful muscle, the size of a fist, beats 100,000 times a day. Each beat keeps 5 liters of blood moving around the body, supplying the oxygen it needs to stay alive. Over time, damage or strain on the heart can cause it to weaken, meaning it can't fill or pump as it should. Not to be confused with a heart attack, where the heart's blood supply is suddenly stopped. Heart failure is a gradual decrease in the heart's ability to pump enough blood around the body. There are 3 types of heart failure which depend on a patient's ejection fraction. Heart failure with a reduced ejection fraction, HFrEF, a mid-range ejection fraction, HFmrEF, and a preserved ejection fraction, HFpEF. Ejection fraction is the percentage of blood that leaves the heart in a single beat. Today, we are going to learn about heart failure with a reduced ejection fraction and with a preserved ejection fraction. Imagine the action of the heart, filling and then squeezing to push blood around the body, like a tank of water with a pump, with the pull of the lever representing a heartbeat. The action of a healthy heart is like being able to fill the tank with water and empty most of this tank with a single pull of the lever. In heart failure with a reduced ejection fraction, the tank can fill, but the pump is weak. This means that when we pull the lever, less water will leave the tank. In heart failure with a preserved ejection fraction, the heart muscle is stiff, meaning the tank can't fill with as much water, so less will come out when the lever is pulled. For the more than 60 million people living with heart failure, this means daily life can be a struggle. Simple activities like walking, climbing stairs, and carrying shopping can become very difficult. It can cause symptoms like shortness of breath and swelling of the feet and legs. When symptoms worsen, it can leave patients in a downward spiral. They may experience a worsening event, for example, really struggling to catch their breath, which could mean being rushed to hospital or needing urgent treatment. This can be very frightening. Around half of heart failure patients are back in hospital within 30 days of a worsening event, with each hospital visit doubling the risk of death. Despite significant treatment advances, the outlook for patients is poor. Sadly, half of these patients will die within 5 years of diagnosis. Heart failure is a devastating condition. More must be done to help patients recognize when their symptoms are getting worse. Doing so will help them stay out of hospital and remain healthier for longer.